Kaslo is pretty unique. They really do a home health model here.
This new addition to our model with the community paramedics has allowed us to reach into a population that we weren't able to reach before.
Since we lost our 24/7 health care, it's become especially important to have that coverage outside of the doctor's office.
We've been able to go out into the community and identify these vulnerable individuals or individuals who need a little bit of additional support and allow them to reduce the acuity of their problems.
All these chronic conditions that are really hard to manage, hard to understand, we can do education about that and help them take their healthcare into their own hands.
Hi, Louise. How are you?
Good morning. Once a month, they come in and they do all kinds of in-services for us in regards to what you should be looking for as you age.
Emily, nice to meet you. Nice to meet you.
One of our
community paramedics.
Oh, you look quite spectacular, sweetie.
Thank you, dear.
The doctors get together with the nurses, physiotherapists, and the occupational therapists, and we all get into a room once a week and we discuss clients that are of concern or bring to someone's attention somebody who is maybe falling through the cracks and maybe just needs that little bit of extra care. Building the relationship is ongoing and it can take a long time, and once you're in that relationship, you can really see what a difference you've made. Hey, Diane. We're here, hon. So you've been well?
Yes, yeah, I've been pretty good. Yeah, nothing.
There's so many patients who say, I want the community paramedics to come in, but I don't want home support. So it allows us to have somebody in there teaching them exercises, watching them with their medications.
Oh, I forgot to write down yesterday's.
Okay.
I took some yesterday, so
Okay.
I forgot to write.
Can I write it down for you?
Yeah,
Okay.
I had in the afternoon, and then I had 2 during the night. To be able to stay in my home is wonderful. And I just know that, you know, they're there if I can call them if I need to. Otherwise, I would probably end up in the hospital.
Have you been eating dinner?
Well, I've been eating something. I don't necessarily call it dinner, but a bowl of cereal or,
Oh, yeah.
you know, it just depends on how I feel.
We were able to realize that she's palliative and she's not on the palliative programming, and the doctor thought she was on it, home support thought she was on it, and it didn't sort of get caught that she wasn't on the program.
Their ability to identify this with her allowed us to open doors and allowed her to access the palliative care program to help with her pain medications, to allow her to have extra benefits.
When you're living alone and you have a chronic illness, it's just comforting to know that they will be here, you know, once a week and more if I need them, and I can always call them. It's just a comfort to know that.
People live a long time in Kaslo and they want to stay in their community, and unless we had the paramedics helping us and keeping us in check, we wouldn't be able to do that.
They're really great girls. Well, this one is nuttier than a fruitcake. She makes me laugh. I love her. She makes me laugh.
It's a great program that's helping people, you know, stay at home longer instead of going into the hospital.